And now that we've seen in the cytokine era that there was a benefit, in target therapy era it's a bit controversial. Now we have these immune checkpoint inhibitor era where we have even more effective systemic therapies. So is cytoreductive nephrectomy relevant at all? So we set out to ask this question in this study. We used the very large IMDC database, which is consecutive patients with metastatic renal cell carcinoma from more than 40 centers across the world. We started with an initial consecutive series of more than 11,000 patients with metastatic RCC. After boiling it down to our question of interest and our patient population of interest, we ended up with roughly 4,500 patients that we then divided into first-line targeted therapy treated patients and first-line immune checkpoint inhibitor treated patients. Each of these, there was a subset treated by cytoreductive nephrectomy and a subset treated by no cytoreductive nephrectomy. Now the first question we asked was, in this very large series, who are the patients that are getting cytoreductive nephrectomies? We found that these were patients that were younger, had lower risk disease, and tended to actually have some adverse histological features, potentially because systemic therapies are not very effective for patients with those adverse histological features. And then the meaty question was cytoreductive nephrectomy still associated with an overall survival benefit in the immune checkpoint inhibitor treated patients? What we found was that the same signal we had seen in the target therapy era, we saw again in the immune checkpoint inhibitor era. And we tried to be very diligent in how we corrected for confounding factors, because we know that this is an important issue with retrospective studies. So we did two separate statistical analyses called a propensity-based analysis and a multivariable analysis, and both found that the immune checkpoint inhibitor benefit of cytoreductive nephrectomy, the benefit of cytoreductive nephrectomy in the immune checkpoint inhibitor treated patients was similar to that in the target therapy era.